Please welcome to the stage 3 Ps.
Good afternoon. My name is Sarah Rubin, and I'm so excited to be here with my co-founder, John Barber, to tell you about 3 Ps. So 3 Ps began because we wanted to make it easier to answer the question, what's for dinner? We interviewed and surveyed over 500 individuals to understand how technology is used in the kitchen and in the grocery store. And from the 76 early adopters of 3 Ps, we found that they were using this application not only because they wanted to eat healthier, but because they needed to eat healthier. So then we spoke with dietitians, patients, providers, and also payers. And we met Patrick. He was recently diagnosed with high blood pressure and cholesterol and wanted to improve his health outcomes by eating healthier. But at the doctor's office, he received only about 10 minutes of nutritional advice and really struggled to translate that when going to the grocery store and facing over 40,000 options. He hired a registered dietitian and met with her to get more meal plans and learn how he could better incorporate this nutrition into his daily life. However, she asked him to track his daily food intake into MyFitnessPal. And MyFitnessPal is so cumbersome that many dietitians don't even want to use it themselves. His dietitian runs her own private practice, and for every hour of care that she provides Patrick, she spends 3 to 4 hours creating meal plans and providing additional support. She wants to continue providing this level of care to all of her patients, but finds it very difficult to grow her business. So with this patient and provider relationship, there are several problems. Patrick struggles to translate the 10 hours of nutritional advice he receives a year into the 476 hours he spends alone in the kitchen or in the grocery store. His dietitian struggles to both continue to provide high-quality care to all of her patients while growing her business and thinking through the next steps. 3 Ps is a solution. 3 Ps is a digital nutrition coach that helps patients plan, purchase, and prepare healthy foods. So it's a software as a service platform for registered dietitians and an award-winning mobile app for patients. It helps Patrick when he's at home and in the kitchen thinking through, again, the many decisions that go into planning, purchasing, and preparing his healthy food. And it helps the registered dietitian continue to provide flexible support to all of her patients while expanding her business and growing into new areas.
When Patrick and his dietitian meet for the first time, they go through an industry standard process that intakes Patrick into the relationship of working with a dietitian. They talk about his relationship with food, his health history, and his health goals, as well as his skill in the kitchen and his food budget. 3 Ps takes this information and automatically customizes the recommended daily values for Patrick based on his lifestyle and health goals. His dietitian can further customize this information to say it only has 20 minutes to cook, as well as his budget in the grocery store. With this information, Patrick logs into our award-winning mobile app and sees recipes designed for his lifestyle, budget, and health needs, making it easy for him to find healthy meals. He picks some recipes and sees exactly the ingredients he needs, and in one click adds all into his shopping list, making it easy for him to plan healthy meals. In fact, it is so easy, he can plan an entire week's worth of groceries in less than 15 minutes. With this information added to his shopping list, he can shop around his house, go to the grocery store, and we are actually working with Meijer on a potential partnership that will let Patrick order curbside pickup, making it extremely convenient for him to purchase healthy meals. So tonight, when Patrick gets home and he's wondering what's for dinner, he sees recipes that he can cook right now using the ingredients in his kitchen. We walk him through the recipe of actually cooking it to prepare the healthy meal. And at the bottom of it, he just clicks Cook and Update Pantry, a single action that tracks his nutrition, sharing that valuable data with his dietitian. And our algorithms will use that history to optimize future recipe recommendations to help him optimize his health. Between appointments, Patrick's dietitian can see if he's on track, reach out as needed, and they spend time at their next appointment not asking him to go through a dietary recall, which is an inefficient process and inaccurate method, but they look at his past history and they spend time with him discussing his goals for the future, helping him really work toward his health goals. business model, as Sarah said, is a SaaS platform delivered to dietitians. And we focus on independent dietitians because they are focused on growing their business, and 3Ps provides them a valuable way to do that. Key partners in this that we have include exercise trackers like Fitbit, grocery stores like Meijer, and we've also begun conversations with the American Heart Association and the American Diabetes Association to license some of their recipe content for individuals like Patrick living with chronic disease. Nutrition impacts over 117 million Americans living with some form of chronic disease. While independent dietitians is a small market, it is our gateway into fast-growing markets and employee wellness markets, as well as health.
Excuse me. It is a fast-growing market to health and employee wellness, which are both growing at 8% and 35% annually. We face competition. Our biggest competitors are Eat Love and That Clean Life, which both provide dietitians a similar platform, offering them the time savings of meal planning, but they don't provide Patrick the flexibility he needs for when life changes. Sarah and I are just two members of our team. The rest, unfortunately, couldn't be here tonight, but we have over 20 years' experience in healthcare, entrepreneurship, nutrition, and technology, and we are advised by a registered dietitian who has worked in tech startups as well as runs his own private practice and is excited to beta with us. Thank you.
Hi, thanks. Two questions, actually unrelated. Can you say a little bit more about the 76 early adopters? How did you find them?
Yeah.
What were the demographics? And then actually, you must have said this morning, but I just caught it for the first time tonight. Award-winning mobile app. Maybe you could say something about that also.
Sure. So first on the app, since that came first. Last year, we had the honor to work with the School of Information's Design Clinic. So that's a program where they run 12 teams through the process of designing various mobile applications. And last year, it was focused on health. And so 3Ps, which was then Nutritious Grocer, came in first in that competition. The second question about the users, we put up just a landing page and said, hey, we make it easy to plan, purchase, prepare healthy meals. And we put that out on BetaBound, which is a website that helps tech companies get early adopters. So we don't actually know the demographics for that, unfortunately. But that's how we found, Patrick was one of the people who signed up for that, and then we reached out to talk to him and several of the other folks there.
And the app is live, so they were able to use the app on the mobile app for patients is live on iOS beta, so they were able to use that on their phone and go through the daily actions that we talked through.
Thank you. So I can't tell, or I couldn't tell from the presentation, if you're preaching to the converted, meaning that you've already are working with engaged patients. So if you could speak to that. And then two, I would see, building on your note about demographics, that this would be a great opportunity for the elderly population, senior citizens in this country, as well as those suffering from chronic diseases. Are there any specific chronic diseases that you want to target?
So right now we are targeting somewhat engaged patients, individuals who are currently looking for nutrition advice or have received, information from their doctor that that's an area they should be looking into, just because we do know that initial push is a very hard sell. And so we wanted to first start with this population that they know they want to make a change, they're not sure what to do, become overwhelmed. Here's a tool that can help you. But with learnings from that group and learning about best practices in terms of motivation and engagement, do plan to next move into individuals who are not specifically directed into nutrition and might just be or thinking about the employee wellness space. We know a lot of employees will meet with a nutritionist maybe once a year. And so thinking about how we can get people who don't really think about it to use 3Ps as a step in for that.
I know a pair or two that might be interested.
Yes, yeah.
And we'd love to talk to you after that.
Yeah.
So we looked at several, obviously diet spans chronic disease. You can go all the way from just weight management, type 2 diabetes, cardiovascular, to cancers. We chose to start with these three because from a diet perspective, they're well researched. They don't require a lot of specialties in terms of the diet that you're recommending. Once you start getting into the cancers, then you start getting down to kind of the micronutrient level of what you're recommending. And so independent dietitians really are our gateway into much larger opportunities.
And we wanted to start with specific health conditions that had a lot of research on the savings that could be produced by diet changes.
I wanted to say congratulations. I think you guys did a great job of just interviewing so many people, over 500 people, and getting so many early adopters. A question I wanted to know is just about market penetration and how many dietitians, as we're thinking about the target market, how many of them are there, and what is the rate of penetration that you plan on going after in the beginning as you try to reach them?
Sure. So there's about 140,000 independent dietitians throughout the United States. As we talked with them, we found several ways to reach them. So there's two industry publications that almost everyone we talked to read, Smart Brief Daily and Today's Dietitian. LinkedIn, we can target any registered dietitian for about $6 per click. Some Facebook groups, industry events, as well as several mailing lists. And then we also talked with them, and a lot of independent dietitians talk amongst kind of their classmates. So especially for younger dietitians just starting out, they are working in a clinical setting, trying to build their own independent practice. They're talking about the tools that they're using with one another. So we do see some opportunity to leverage that.
I'll just, given time, go straight to it. So can you talk a little bit about, from your research, what you've thought about in terms of pricing, and then what kind of costs you're going to see and where you're going to access capital? We talked about this earlier.
Yep.
I'd like to...
So starting off with dietitians, we are looking at pricing at $500 a year, again, tiered based on the number of patients they actually see. This is actually pretty competitive. Some of our competitors price at $600 to $900. And then one of the things that we're working with is how do we keep patients engaged for longer, whether that's directly with us or with the dietitians helping them boost their revenue as well. So maybe you're not having a weekly or biweekly appointment, but maybe you're then signing up for an mHealth app linked to your dietitian that sends you kind of weekly or biweekly progress reports about how you're progressing after you've gone before that. On the consumer side, that price is at about $54, and then employee wellness plans, it's about $1 to $4 per employee.